What is the most common cranial mononeuropathy in diabetic patients? A. Cranial mononeuropathy 6. B. Bell's palsy. C. Auditory neuropathy. D. Third nerve palsy. The answer is D. Third nerve palsy. Third nerve palsy, cranial nerve 3, the oculomotor nerve, is the most common cranial mononeuropathy seen in diabetic patients. They will present with ptosis, dilated and fixed pupils, and an outward and slightly downward deviation of the eye. Bell's palsy involves unilateral facial paralysis as a result of damage to the facial nerve, cranial nerve 7. Cranial mononeuropathy 6 is caused by damage to the abducens nerve, cranial nerve 6. Signs of damage include inability to laterally rotate the eye and/or double vision. Auditory neuropathy may be a result of damage to the vestibulocochlear nerve, cranial nerve 8. The most pronounced symptom is loss of audition. What condition is described by the following? A defect of copper excretion, leading to copper overload and feedback inhibition of ceruloplasmin synthesis. A. Wilson's disease. B. Huntington disease. C. Ceruloplasminemia. D. Hereditary hemochromatosis. The answer is A. Wilson's disease. Wilson's disease is characterized by a defect of copper excretion, leading to copper overload and feedback inhibition of ceruloplasmin synthesis. This results in copper accumulation, primarily in the liver and the brain. Signs and symptoms include liver failure, cognitive deterioration, clumsiness, and changes in behavior. Symptoms often start in adolescence, but can start any time between 6 to 20 years old. Ceruloplasminemia is a rare condition of iron accumulation in the basal ganglia, retina, and liver. Hereditary hemochromatosis is also a disorder of iron accumulation, often caused by mutations in the HFE gene. Huntington disease is a genetic neurodegenerative disease unrelated to any mineral storage disorders. A 62-year-old male client is admitted to the hospital with acute pancreatitis. The client has a well-established history of alcohol abuse. The nurse caring for this client is aware he may exhibit withdrawal symptoms during the inpatient course. The nurse's plan of care for this client should include assessment for all the following symptoms of alcohol withdrawal except A. Hypersomnolence. B. Tremors. C. Visual hallucinations. D. Hypertension. E. Seizure within the first 24 hours. The answer is A. Hypersomnolence. The symptoms of alcohol withdrawal may include confusion, disorientation, and anxiety. Hypersomnolence or excessive sleep is not associated with this condition. Additional symptoms may include agitation, hypervigilance, tremor, rapid and irregular heartbeat, hypertension, seizure, and hallucinations, mostly visual. Approximately 80% of strokes are of what type? A. Hemorrhagic. B. Transient ischemic attack. C. Ischemic. D. None of these. The answer is C. Ischemic. Approximately 80% of strokes are ischemic, either caused by thrombus or emboli. Hemorrhagic strokes only account for approximately 15% of all strokes, but are significantly more lethal and account for 30% of all stroke deaths. They involve the rupturing of a weakened blood vessel in the brain and subsequent bleeding in the surrounding areas. Transient ischemic attacks are not considered true strokes, and are often referred to as mini strokes. Which artery is most commonly involved in ischemic stroke? A. The middle cerebral artery. B. The anterior cerebral artery. C. The posterior cerebral artery. D. The posterior inferior cerebellar arteries. The answer is A. The middle cerebral artery. The most common artery occluded in ischemic stroke is the middle cerebral artery, which supplies a large percentage of the frontal lobe and the lateral surface of the temporal and parietal lobes. Occlusion of this artery affects the motor and sensory areas of the face, throat, arm, hand and the areas for speech.